Hello, my name is Miss White, and I'll be talking about Chapter 17, and this is all about altered nutrition. It's important to note that nutrition is important for energy and to develop energy for ultimately metabolism in the body. So there are several components of nutrition that we consider. We consider energy as the capacity to do work, and normally this is utilized through carbohydrates. We have metabolism, which is fueled by energy, and that helps to produce heat, conduct impulses, and helps muscles to contract. We have water that helps with solvent and being a universal solvent with the vital processes in the body. We have macronutrients that include protein, carbohydrates, and lipids, and then we have micronutrients that includes vitamins and minerals. These are the four hormones that are responsible for food intake and energy, regulating energy within the body. We have ghrelin and leptin, which is more associated with our food intake and stimulating the body to want to eat, where we have insulin and glucose, which glucose helps fuel the body as the carbohydrate, and insulin helps to maintain glucose levels. So all of these work in tandem with stimulating the body to eat to help gather nutrition and then manage nutrition once it enters into the body. So as we're talking about the alterations of nutrition, look at these several concepts that you could have. You could have inadequate or excessive digestion, absorption, transportation, or metabolism of nutrients, and that includes water, that includes your carbohydrates, lipids, vitamins, minerals, things that are associated with your nutritional status, or those basic components, those micronutrients or macronutrients. When you have excessive or inadequate amounts of those, that will alter your metabolism overall. You can have genetic defects that causes alterations in nutrition. You can have the ineffective intestinal mucosa that would alter the absorption of those nutrients. You could have inadequate or excessive intake that would lead to altered nutritional statuses. You have excessive nutrient losses, so you're unable to keep the nutrients that you intake. You have hypermetabolic states where the body is moving too fast, where they're not absorbing the nutrients that it needs because it's going through the body too fast. You have malabsorptive syndromes where your body is ingesting the nutrients, but it's not being absorbed to the capacity that it needs to in order for the body to use it. And then you have the ingestion of unsafe food and water. Here's a concept map that is an overview of altered nutrition. You have three major categories. You have overnutrition, undernutrition, and altered metabolism. When we have overnutrition, we have too many calories that we're intaking, which could lead to obesity, too many vitamins and minerals, which would cause a toxicity. When we have undernutrition, we can have that under three subcategories, which is inadequate intake. So if you don't take in enough nutrients, of course, that would be undernutrition. You have altered digestion, where you're taking in what you need, but it's not processing correctly. Or you can have where you're intaking what you need and it digests, but there's no absorption to where it needs to go. Ultimately, these categories result in either macronutrient deficiencies, and those macronutrients do include those carbohydrates, those lipids, and those proteins, or micronutrient deficiencies, which includes those vitamins and minerals. And then you have altered metabolism. So when we talk about metabolism and proteins particularly, those are amino acids. So if you have impaired amino acid or lipid metabolism, you can end up with a condition called PKU, and we'll talk a little bit about that today. Or you may have lysosomal storage diseases such as Tay-Sachs. So overall, this is your picture of what altered nutrition looks like, and just understand that you have three main categories. That's overnutrition, undernutrition, and altered metabolism. So when we talk about inherited metabolic disorders, it's important to note that this is a genetic issue, and oftentimes it's related to errors in your amino acids. As a reminder, amino acids help to build proteins. So proteins are what compose of enzymes. So if you have a problem with the amino acid base, which ultimately leads to the protein or the enzyme development, then ultimately you have a defect in your enzyme activity. And such examples include phenylketonuria or PKU or Tay-Sachs disease. As I've mentioned, undernutrition is considered a lack of intake of nutrients, and this can be considered due to inadequate calorie or carbohydrate consumption. You can have inadequate intake of vitamins and minerals, those macronutrients or micronutrients. You're not taking in enough of those, or you can have a problem with digestion, absorption, or distribution of nutrients within the body. Ultimately, this results in weight loss and muscle wasting. We look at two different areas of undernutrition, and we consider something called marasmus or starvation versus core or protein deprivation. Next, we have overnutrition, and this is excessive consumption of nutrients, and that's both macronutrients and micronutrients due to excessive caloric intake, or you may end up with a vitamin or mineral toxicity. When we talk about overnutrition, this is the lack of movement of one or more nutrients across the gastrointestinal mucosa. So you give your body too much of these nutrients and it overloads the body, causing your GI tract or the mucosa in the GI tract not to absorb things very well. So again, you do see those problems with processing and digesting nutrients because there's an overwhelming amount of them to process. You again see those problems with the intestinal mucosa because it's not processing well, and you may even see some lymphatic obstruction, which could lead to some issues with immunity and things of that nature. Next, we'll talk about food allergies, and this is something we've discussed before with the immune system response, but overall it is a response to things that are not normally considered dangerous or harmful. An individual has a adverse reaction that can cause allergies such as itching, contact dermatitis, swelling, or even even anaphylactic shock, which is life-threatening. So some examples of allergies include milk, soy, fish and shellfish, tree nuts, wheat, peanuts, eggs, things along those lines that are not normally harmful to a human body at baseline and causes an allergy to someone that is altered in their nutritional status. This is called a food allergy. As far as your manifestations, diagnostics, and treatment of altered nutrition, general manifestations is either weight loss for undernutrition or weight gain, depending on if it's overnutrition. You may have muscle wasting and weakness as a result of both of those. You'll see changes in the skin and mucous membranes. You will have a problem with wound healing because nutrition is directly related to wound healing. If you don't have the proteins or the basic components that would help the body sustain life, you cannot heal wounds. So you'll see issues with that. As far as other issues, you may even see dehydration, diarrhea, nausea, vomiting, abdominal pain, and fatigue. As far as your diagnostic criteria and strategies, you want to do a nutritional assessment. You want to do dietary intake and recall. You want to measure height, weight, and BMI. As far as your laboratory tests, you want to get a erythrocyte sedimentation rate. You want to look at an individual's electrolytes because they are heavily influenced by nutrition, especially that sodium, potassium, magnesium. All of those electrolytes heavily influenced. Even calcium is heavily influenced by that. You want to get a urine analysis and urine culture to see even if those electrolytes are being excreted, or you can evaluate urine analysis for ketones or glucose levels just to make sure that a patient is not going into some type of diabetic issue or even DKA, diabetic ketoacidosis. So you have different diagnostic criteria and strategies to assess nutritional status. As far as your treatment, you want to do some dietary interventions. You want to, if it's undernutrition, you want to encourage intake of macronutrients and fluids. You want to encourage taking vitamins and mineral substances and supplements. For obesity or overnutrition, you want to reduce the overall caloric intake. You want to avoid specific foods, and then you may even seek pharmacological methods for that, particularly such as exogenous digestive enzymes, which help the body process nutrients when ingested. Here are our applications of concepts of altered nutrition. Feel free to take out your syndrome disease cards and fill them out as we discuss each one of these concepts. First, we'll talk about iron deficiency anemia, and this is considered insufficient iron storage to meet the needs of red blood cell development. As a reminder, iron is required and necessary for hemoglobin to have an affinity for oxygen on those red blood cells. So, without iron, that affinity is not as adequate, so that ultimately results in an oxygenation issue if it's very severe. So major causes of iron deficiency anemia is inadequate iron intake. You may have chronic hemorrhage, you may have iron malabsorption syndromes, or you may have high iron demands. As far as your clinical manifestations, you're often asymptomatic, but in its severe form, you do see pallor or paleness of the skin and mucous membranes. You see fatigue, weakness, syncope, headache, and lightheadedness. You may feel short of breath or breathlessness, and that has to do with that oxygen component, and iron not being present doesn't allow oxygen to bind to those blood cells very well, red blood cells very well. You may see palpitations and tachycardia. You'll see brittle hair and nails. You may see mouth sores in individuals with iron deficiency anemia, and you may also see them eat pica. And pica or pica is where more prevalently you see individuals eat chalk, but you do have cases where some eat cigarettes, sand, things that are not normally ingested to help find those iron stores to help the body get what it needs. But ultimately, pica can be dangerous because if you're ingesting those things, you're subjecting yourself to other harmful agents that are associated with those materials. As far as your diagnostic criteria, of course, you have to have a history of physical exam. Your laboratory studies include hemoglobin and your hematocrit. You want to look at your mean corpuscular volume, your mean corpuscular hemoglobin concentration, your red blood cell indices, and you'll also look at your serum ferritin, which is your iron count. As far as treatment, you want to reverse the cause, increase the iron intake through diet and or supplements.
The next disease that we'll talk about is anorexia nervosa, and this is an eating disorder characterized by the inability to maintain a healthy body weight. So you have an intense fear of gaining weight, you have very destructive habits, and severe image distortions regarding your own body. So with anorexia nervosa, not only is it a nutritional disorder, but it is considered a psychiatric disorder because of those intense image distortions and obsessions with perfection and having the perfect body. So, as far as your risk factors, you have female sex, you have family history, individual that's introverted, obsessive, may have perfectionistic personality. They may have the inability to resolve conflict, have low self esteem, or they have familial dysfunction. As far as your clinical manifestations, you have restricted caloric intake, you have extremely thin stature, you have lanugo, amenorrhea, brittle hair and nails, peripheral cyanosis, dry skin, bradycardia, hypotension and hypothermia, abdominal bloating and constipation. With hypothermia, it makes sense because that individual does not have enough body fat to help insulate the body. And as far as hypotension, there's a fluid deficit. So, therefore, because the individual is not taking in a lot of supplements, so you have low blood pressures as a result of that, as well as bradycardia because there's not enough fluid to be pumped throughout the body. As far as your diagnostic criteria, you have a history and physical examination. Um, Regarding your DSM-5 criteria, and that's just the diagnosis of mental disorders criteria, you have restricted food intake, which leads to low body weight. You have fear or avoidance of gaining weight despite low BMI. You have a disturbed body image. You would do a nutritional assessment. You'll also conduct laboratory studies, particularly with your electrolytes and protein levels, to see where that individual is. You may even look at albumin levels for these individuals. And you'll also look at an EKG or electrocardiogram to see how the heart is doing. As far as treatment, it is an interdisciplinary approach with nutrition replacement as well as psychotherapy. The goal is to achieve and maintain a healthy weight and nutritional intake. So psychotherapy helps with the cognitive issues with perfectionistic personality, with the obsessiveness, even with low self-esteem or family dysfunction. And then you have the nutritional support. Oftentimes, you may see these individuals with TPN, lipids, some type of nutritional replacement until they're able to tolerate foods again through the mouth. Regarding celiac disease, this is a gluten sensitivity. So, this is characterized by a T cell mediated hypersensitivity reaction in individuals that are allergic to wheat, rye, oats, and barley. So, the clinical manifestations are consistent with those of malabsorption. You have weight loss, diarrhea, you'll have a lot of gas or flatulence, steatorrhea, you may have malodorous stools, Bobrigamus, which is loud stomach or intestinal rumbling. You'll see abdominal bloating and pain, fatigue, and or nutritional deficiencies, particularly in vitamins and minerals. Um, you have diagnostic criteria, which would be your laboratory tests on those vitamins, minerals, electrolytes. It is based on your clinical manifestations, and they will also test you for antibodies against gliadin, indomycin, or IgA. And the reason why is because these are most prominent with your rye products or wheat products. Your diagnosis is confirmed with a small bowel biopsy. When they treat this, you want to eliminate gluten from the diet. So you have to avoid foods with wheat, rye, oats, and barley. You want to supplement with vitamins and minerals, and you may even have pharmacological treatments to help with the inflammatory response. So you'll have anti inflammatory medications and you have hypersensitivity blocking medications. Normally, your symptoms should improve with 2 months, 1 to 2 months, if these are implemented appropriately. Next, we'll talk about phenylketonuria, and this is an autosomal recessive disorder caused by a mutation in the PAH gene. PAH is for phenylalanine hydroxylase. Um, Phenylalanine hydroxylase gene does produce phenylalanine hydroxylase enzymes, and these enzymes metabolize or break down phenylalanine. So, when we don't have this enzyme available, PAH, we have phenylalanine that accumulates in the body fluids. Well, normally, if it's not broken down, it cannot be broke or converted into tyrosine. Now, the importance of tyrosine is that it is an amino acid that helps with the production of neurotransmitters that include epinephrine, norepinephrine, and dopamine. These are your cholinergics and they act on the sympathetic nervous system. So, when you have a deficit of tyrosine, it leads to neuropsychosocial issues or neuropsychological issues, excuse me. So, the clinical manifestations is that you have intellectual disability, you have fine or fair hair and skin, you have hypopigmentation of the eyes, you may have a musty odor, and you may even present with seizure disorder due to those neurotransmitters that are affected. Your diagnostic criteria often occurs at birth, and you have a metabolic screening that helps with this. In countries that you don't have newborn screening, you do see PKU, phenylketonuria, in more elevated levels in those countries, and you do see developmental delays and intellectual disability occur in those populations. As far as treatment, you want to have nutrition, and there is lifetime dietary management. You want to avoid phenylalanine or high protein foods. You want to supplement with tyrosine because that's what's deficient at this point. So think about it. You have high levels of phenylalanine in the body already, so you don't want to add more phenylalanine with these high protein foods. Instead, you want to encourage more tyrosine, vitamins, and minerals because those are the things that are deficit in this condition. And then you want to have pharmacological therapy, which includes sapropterin dichloride. The next thing we'll talk about is obesity, and this is defined as excessive body fat of a BMI of greater than 30 kgs per meter squared. And again, when we discuss BMI, just know that there is multifactorial issues that are associated with BMI. So just because it's elevated doesn't necessarily mean you are obese, but these are one of the diagnostic criteria. You do have different types of obesity. You have hypertrophic, where your adipose cells are increased in size. You have hypercellular obesity, where you have an increase in the number of adipose cells. So they're not necessarily bigger, it's just a lot more of those adipose cells. It is a complex and multifactorial etiology, but the risk factors do include genetics and your lifestyle. If you have a sedentary lifestyle, you're more likely to become obese because you're not working those calories that you're taking in. You do have neurological mechanisms and hormones that are associated with this. You have leptin and estrogen, thyroid hormone, insulin, melanocortin, and ghrelin. As far as your clinical manifestations, again, it's excessive body weight and fat. You have truncal abdominal or gluteal femoral disposition, and more. And what that means is that you have more fat in those areas. And you do have numerous health risks that are as a result of obesity. And this includes diabetes mellitus, heart disease, hypertension, hyperlipidemia, stroke, osteoarthritis, liver disease, gallstones, poor wound healing, sleep apnea, and certain types of cancers. As far as your diagnostics, you have to have a history and physical examination. You have to evaluate for comorbidities, which we discussed. That's the diabetes, heart disease, hypertension, hyperlipidemia, etc. And they also look at your body mass index. And again, you are considered obese at 30 kgs per meter squared, but then you have different levels of obesity thereafter. You are considered severely obese at a BMI of 40 or greater kgs per meter squared. So, as far as treatment, you want to have lifestyle interventions, diet, exercise, and behavioral modifications. You may have pharmacological therapy, and then sometimes you have surgeries to help reduce the amount of fat within the individual. So, you may even see these individuals get gastric bypasses. You may see these individuals get liposuction to remove the actual adipose tissue from the fat areas. So, again, obesity is a common problem within the U.S. and it's elevated due to the convenience of different areas. Like you can even order things from the store now, so you don't have to get up and walk to these places. You can order a lot of things in, so you don't have to physically move. You can ask others to, just cut grass or do things that you would normally do by yourself. So, again, this is becoming a prevalent problem within the U.S., particularly, and it's something to note. Again, I just want to highlight those complications of obesity. You do have sleep apnea, hypoventilation, which is a decrease in your breathing. You may see apnea as a result of that. You'll have gallstones and osteoarthritis, which is where your bones are not working as well, and you're starting to have pain in those extremities because those bones cannot support the body weight anymore. You have diabetes mellitus, poor wound healing, coronary artery disease, myocardial infarction, hypertension, and hypoproteinemia, which is high levels of protein in your blood, and stroke. Make sure you complete the guided learning questions. Make sure you look at your system disorder cards. Make sure you look at your case studies and activities. Make sure you review your pathophysiology, your clinical manifestations, diagnostics, treatment, and application. Ensure that you quiz yourself and others and answer your questions in your textbook. And make sure you reach out if you have any questions. Thank you and have a great day.